This is Medicare's newest payment program that 179,000 seniors signed up for in just 2 months, yet 95% of people who could benefit from it don't even know it exists. The Medicare Prescription Payment Plan launched on January 1, 2025, promising to help millions of Americans manage crushing prescription drug costs through monthly installments instead of massive upfront payments. But here's what Medicare isn't telling you about this program, and what you absolutely need to know before you sign up. The Medicare Prescription Payment Plan, sometimes called smoothing, emerged from the Inflation Reduction Act that President Biden signed on August 16, 2022. This wasn't just another government program thrown together quickly. It represents the most significant overhaul of Medicare prescription drug benefits since Part D launched in 2006, complete with a new $2,000 annual out-of-pocket cap that replaced the previous $8,000 limit and eliminated the infamous donut hole coverage gap that plagued seniors for years. Think about that for a moment. Seniors were paying up to $8,000 out of pocket for medications in 2024. Now, that's capped at $2,000 in 2025, rising to just $2,100 in 2026. The Centers for Medicare and Medicaid Services estimates that 11 million Part D enrollees will hit this new cap, saving an average of $600 each. That's $7.2 billion in total savings flowing directly back to seniors' pockets. But the payment plan itself? That's where things get complicated. Here's how it actually works. When you fill a prescription at any pharmacy, whether retail, mail order, or specialty, you walk out without paying a dime at the counter. Sounds amazing, right? Instead, your Medicare plan sends you a monthly bill. This bill takes whatever you would have paid for prescriptions that month, adds any previous balance, then divides that total by the number of months remaining in the year. Let's say you fill a $1,200 cancer medication in March. Normally, you'd pay that $1,200 up front after meeting your deductible. With the payment plan, that cost gets spread across the remaining 10 months of the year, making your monthly payment $120 instead of that massive March hit. The math seems straightforward, but the reality is far messier than Medicare's promotional materials suggest. Dr. Meena Seshamani, CMS Deputy Administrator, called this meaningful additional cost savings and relief to enrollees who have been facing high and rising drug costs. But here's the first thing they don't explain clearly. This program doesn't save you a single penny. You're still paying the exact same total amount for your medications. This is purely a payment plan, like financing a car or spreading out a credit card balance. The second hidden reality: your monthly payments can swing wildly from month to month. Every time you fill a new prescription or refill an existing one, the payment calculator kicks in again. It takes your new out-of-pocket costs, adds them to your remaining balance, then recalculates based on how many months are left in the year. Imagine you're cruising along with $150 monthly payments, then your doctor prescribes a new medication in September. Suddenly, you've got only 4 months left to spread out thousands of dollars in new costs. Your October payment could jump to $400 or $500, completely destroying your budget planning. And here's where it gets really problematic. Your largest bills might come at the end of the year, exactly when many seniors are already stretched thin by holiday expenses. Once you hit that $2,000 out-of-pocket cap sometime during the year, you stop accumulating new costs. But you're still on the hook for spreading out everything you've already incurred across the remaining months. The first month presents its own challenge. Depending when you opt in, your initial payment could equal your entire out-of-pocket costs for that month. Start the program in June with a $2,000 medication fill, and you might owe the full $2,000 that first month before the smoothing even begins. Only 179,000 people enrolled in the first 2 months. That's just 0.4% of the 45 million Americans with Medicare Part D coverage. CMS projected that 2.4 million people, about 6% of beneficiaries, could benefit from this program. So, why the massive gap between potential and actual enrollment? Part of the answer lies in who is actually signing up. 95% of enrollees are non-low-income beneficiaries. This makes sense because people who qualify for extra help or Medicare savings programs already have their prescription costs heavily subsidized. The Social Security Administration processes extra help applications, making those benefits more accessible than this new payment plan for many seniors. For them, the payment plan offers no meaningful benefit since they are already paying minimal amounts out of pocket. But there is a darker reason for low enrollment that Medicare does not advertise. Many seniors who could benefit simply do not know the program exists. Organizations like AARP have published guides on this program to help educate beneficiaries, but these notifications do not reach everyone who might need help managing high drug costs. Your state health insurance assistance program provides free, unbiased Medicare counseling to help you understand these complex options. The technology powering this system comes from a company called Paytient, which handles the back-end infrastructure for 40% of Medicare beneficiaries with prescription drug coverage. That means nearly half of all Medicare drug plan members are using Paytient's system, whether they realize it or not. Meanwhile, major insurers like United Healthcare, Humana, Blue Cross Blue Shield plans, Aetna, and WellPoint are all offering the payment option. But here's what's concerning. As these same companies implemented the new $2,000 cap, many simultaneously changed their plan designs in ways that could offset some benefits. These changes reflect how pharmacy benefit managers who negotiate drug prices influence the broader cost structure of prescription coverage. A Harvard study published in late 2024 found troubling trends. Medicare Advantage plan deductibles, which had been steadily decreasing from $153 in 2019 to just $66 in 2024, suddenly spiked to $228 in 2025. The proportion of beneficiaries facing coinsurance for preferred brand name drugs jumped from around 2% to nearly 28% in 2025. What this means is that while the out-of-pocket cap provides protection for people with extremely high drug costs, those with moderate medication expenses might actually pay more under the new system. It's a classic case of giving with one hand while taking with the other. The timing rules around enrollment create additional complications. You can sign up for the payment plan at any time during the year, but Medicare strongly suggests starting before September. The later you start, the fewer months you have to spread out your costs, making your monthly payments higher. There's also an auto-renewal provision starting in 2026. If you participate in 2025 and stay with the same plan, you're automatically enrolled for 2026. But change plans. You have to opt in all over again. Switch to a different benefit package from the same insurer mid-year. Your participation ends immediately, and you must restart the OPT-in process. Miss a payment? You get one reminder. Fail to pay by the date listed, and you're kicked out of the program entirely. You'll still owe whatever balance remains, but you lose the ability to spread future costs across monthly installments. The program creates particular challenges for people with certain medical conditions. Cancer patients represent a significant portion of those hitting the out-of-pocket cap, with nearly half of Medicare beneficiaries with cancer expected to reach the $2,000 limit in 2025. One-third hit that cap in January alone, often due to expensive oncology medications. For these patients, the payment plan can prevent the devastating choice between paying for medication and paying for housing or food. But it also means they'll carry substantial monthly payment obligations for the entire year, potentially creating cash flow problems that persist long after their initial treatment. The standard Medicare Part D deductible is $590 in 2025, rising to $615 in 2026. Some plans have no deductible, but these often come with higher premiums or more restrictive formularies. The interplay between deductibles, the payment plan, and your specific medications creates a complex calculation that's difficult for most beneficiaries to navigate without professional help. Looking ahead, Medicare's drug negotiation powers are expanding. 15 additional prescription drugs were selected for price negotiations in January 2025, with negotiated prices taking effect in 2027. This follows the initial round of negotiations covering 10 medications with negotiated prices, beginning in 2026. These negotiations could significantly reduce the underlying cost of expensive medications, which would make the payment plan less necessary for some conditions. But the timeline is long, and seniors need help managing costs right now, not in 2 or 3 years. Premium costs are actually decreasing slightly. The average standalone Part D premium is projected to drop by $3.81 to $34.50 in 2026, while Medicare Advantage plans with drug coverage will see premiums fall by $1.82 to $11.50. These decreases help offset some of the deductible increases, but the net effect varies dramatically based on your specific medication needs. So who should avoid this program? Medicare's own guidance suggests the payment plan isn't right for people with low annual drug costs, consistent monthly medication expenses, or those considering enrollment late in the year. If you qualify for extra help or Medicare savings programs, those benefits almost certainly provide better value than the payment plan. The most important factor in deciding is understanding your own medication timeline. If you take expensive medications early in the year, perhaps due to a surgery, cancer diagnosis, or new chronic condition, the payment plan can provide genuine cash flow relief. But if your medication costs are spread relatively evenly throughout the year, or if they spike near year-end, the program might create more financial stress than it relieves. To help with this decision, visit medicare.gov/prescription-payment-plan to use their official calculator that estimates your monthly payments based on your specific medications and enrollment timing. The Medicare Prescription Payment Plan represents a well-intentioned attempt to address a real problem: the crushing burden of upfront prescription drug costs for Medicare beneficiaries. The $2,000 out-of-pocket cap is genuinely transformative for millions of seniors who were previously facing financial catastrophe from their medication needs. But the payment plan itself is more complex and potentially problematic than Medicare's promotional materials suggest. It doesn't save money. It can create unpredictable monthly bills, and it may leave you with your highest payments at the worst possible time of year. Before you opt in, carefully calculate your expected medication costs for the entire year. Understand exactly how the monthly payment formula works with your specific situation, and consider whether other programs like Extra Help might provide better financial protection. The promise of walking out of the pharmacy without paying sounds appealing, but remember, you're not avoiding those costs, just moving them to a monthly bill that might be larger and less predictable than you expect. Sometimes the devil really is in the details, and with Medicare's prescription payment plan, those details matter more than the marketing suggests.